Hi, my name is Richelle Franklin. I'm going to be performing the IV insertion and the DCing of an IV today. But first, before we get started, let's go ahead and do our hand hygiene. All right. And we want to do hand hygiene at least 20 seconds. Make sure we're getting wrists, fingertips, and then make sure that you're not touching the sink with your body and rinsing off all that soap. All right, and then I'm going to go ahead and use my towel. And then we're off. All right, this is going to be our patient over here in this next room. And I'm going to introduce myself. Hi, my name is Richelle Franklin. The doctor ordered you an IV insertion today. Can I have your full name and date of birth, please? Perfect. All right, so I am going to go ahead and gather my supplies. What you're going to need for this procedure is an IV push. It's a sodium chloride push, and then I have my IV starter kit, an IV extension tubing, and my gloves. But of course, you want to make sure that your surface is clean and free of any clutter, of course. All right, we're going to go ahead and start opening up our items in an aseptic technique. So, with that being said, we're just going to go ahead and open them. So, this is our IV tubing, the extension tubing. Both of these extensions at the end are sterile, so we want to keep them sterile. And then we're going to go ahead and prime the tubing with our flush. Open this up. Go ahead and uncap that. Throw away any little items that you don't need, okay? Keep everything free and clear of clutter. So it's going to connect to this end. And then we'll prime that tubing. All right, tubing is primed, and then I'm just going to loosen this cap up just a tad so that it makes it easier for me to take it off later, so when I have less hands. All right. And then my IV starter kit, I'm opening up as well. And we're also going to be grabbing our needle with an IV catheter. Hold on one second. So our needle, I did have some 22 gauges that I used up. So this is our next best option for the smallest needle size that we have. And we'll open that up in a aseptic technique as well. All right, and the first thing that we want to do is go ahead and apply our tourniquet and find our site. So for the tourniquet, it needs to be 4 to 6 inches above the site that we choose. And you want to make sure that it's a quick release so that, you know, when you're busy with your hands, you can quick release. So go ahead and tie that and checking the pulse at the bottom. Perfect, no pulse. All right, and then I am searching for a nice site. Looks like I have one right here for me. All righty, and then we're going to go ahead and glove up. Okay. So now we're going to go ahead and clean our site with our alcohol swab. Go ahead and open that up. And since it's an alcohol swab that I'm using, it's going to be in a circular motion, like a spinning roll. And we're going to wait until that completely dries. Once it does dry, I'm going to use my non-dominant hand to pull the skin taut. And right under where I want to insert, just a few centimeters below. I'm going to go ahead and uncap my needle, bevel up, all right, and go in at about a 15-degree angle. All right, it's going to be a little bit of a pinch and a burn, okay? So I'm going to go ahead and insert my needle and catheter, and about a fourth of the way in, I'm going to go ahead and using my finger, I'm going to go ahead and advance the catheter and not the needle. Once it meets the hub. And now that it is inserted, I'm going to go ahead and use my other part of my hand and push down so that none of the blood comes out while I'm doing this part of the procedure. Go ahead and sharps container. I'm going to release the tourniquet and also connect my tubing. So once again, we want to keep that sterile, so not without touching the top of the cap. We're going to insert it into the hub, and with my non-dominant hand, I'm going to be holding while the other hand is twisting on. All right, now that, oh, and also I forgot to mention that I would make sure that I get flashback in my chamber of my needle before I advance. Which also reminds me, I'm going to aspirate for blood, making sure that it's still open, and then push a little bit to clear the line. Looks like everything is working just fine and dandy. And next up is our Tegaderm. So, our Tegaderm, what's really important is to just make sure that we put on the little beautiful tab that they give us is our name, what gauge we used for the procedure, and the date. So that'll be placed right here over by this site. Now that we have our site secure, we're going to go ahead and loop this and tape it to be secure. We're going to tape it in two separate places. One is going to be down here next to our site, and then the other one is just going to be the hub. And we can clamp this off. So take that, and just so that we're protecting the hub, we're going to do it right next to the hub, and of course we can clamp that off. All right, now that everything is secure and our IV site is prepped and ready to go, we can go ahead and clean up, okay? So take everything that you don't need, you know, sharps in your containers, and everything that you won't need for the procedure that you are going to do next, which is DCing. All right, and then taking off gloves. And we're going to go perform hand hygiene. This one is going to be the hand hygiene that we end the IV insertion with, and then also the hand hygiene that we're going to start the DC with. So go ahead, wash our hands. 20 seconds, dry off our hands, and then right back to our IV patient. All right, now that I did my hand hygiene, I'm going to go ahead and put on some more gloves here. Give me 1 second. Oh, my gloves. Okay, 1 glove, and then 2 gloves coming up. Now that we have both gloves on, we're going to go ahead and remove the tape. So we're going to start with the tape that's on the actual IV insertion site, trying to not pull at the site. Move inward, Tegaderm, and holding that hub down. Super sticky. Now that we have that off, we're going to go ahead and hold and pull this off as well. And we're going to go ahead and, as I'm removing it, parallel, we're going to take our gauze and kind of place it up top so that we're ready to apply the pressure, okay? So I'm going to hold for 30 seconds, and while I'm doing that, I'm going to go ahead and look at my catheter, see if there is any part that is missing. If there is, I would go ahead and tell the doctor right away, and then we are going to go ahead and put that in our sharps container as well, okay? All right, so everything's inspected. It is now time to dress. So what I'm going to do is take some nice fresh sterile gauze. I'm going to put it into a square, and then we're going to be ready to tape it off, okay? All right, and then I would go ahead and clean up my area, doff my gloves, and also perform hand hygiene, and that should be it. Thank you so much for watching me. I really appreciate it. You have a wonderful day. Bye-bye.